Through core project, we are aiming to scale up rapid integrated testing, community-based testing, in 2 of our testing and sexual health centers. They are centers that are working more with 2 specific populations. One is with migrants, in particular undocumented migrants, and the other one with sex workers and trans people normally doing sex work. So the idea is to scale up the testing for the 4 infections: HIV, hepatitis B, hepatitis C, and syphilis, and of course to improve our work related to linkage to care, so supporting people to access treatment. It's very important because for populations that are, first of all, more at risk for these infections, and they are vulnerable in terms of social support or health conditions, quality of life, it's really important that you can support them to access health care. Because although in Portugal we do have a universal health system, so it's free to everyone and everyone can access it, there are still some administrative barriers, especially for undocumented migrants. Apart from stigma and discrimination issues, there are also the fear of accessing a hospital in another country. So it's really important that we can escort them to the hospital, to explain what is going on, to explain what are their rights accessing treatment. So it's really important to ensure that they access healthcare and they remain in treatment. Core has been really important because, first of all, it's funding, which is absolutely necessary for NGOs and community-based organizations to keep working. So it allowed us to scale up testing. But it's also important because we can be part of a broader consortium where we can exchange practices, we can have support for advocacy work, for example. GAT is participating in Core as a local partner, but is also leading the work package for the implementing activities. So for us has been really challenging, but also really good to be part of this group of people in different countries with different contexts, political contexts, different resources, financial, human resources. So for us it has been a really great opportunity to learn with our colleagues in other organizations, but also to support them to scale up their activity and to support them also to start integrating peers in their teams, which for us is really, really crucial in this work. In terms of our local targets that we plan within Core as a local partner, we were able to scale up testing, which was the major objective. We are working with peers, and we are now able to provide training to our peers and to our community health workers, which has been really useful. As work package leaders, we are happy with what we have achieved so far. So most of the organizations, even though those that had very difficult conditions to test in the community and to start testing for other infections, not only for HIV, they are starting to doing it, and they are starting to overcoming barriers, legal barriers, admin barriers, political barriers to do their work. So they are starting to negotiate and have conversations with their governments, with their municipalities. So it's really good to see what we have achieved so far at the middle of the project.